How many cervical vertebrae are present in the human spine? A. 5. B. 7. C. 9. D. 8. Answer, B. 7. Which cervical vertebra is also known as the axis? A. C1. B. C2. C. C3. D. C7. Answer, B. C2. What is a unique feature of cervical vertebrae compared to other vertebrae? A. Presence of costal facets. B. Transverse foramina. C. Absence of spinous processes. D. Large vertebral bodies. Answer, B. Transverse foramina. What is the name of the ligament that attaches to the odontoid process, dens? Of C2? A. Anterior longitudinal ligament. B. Alar ligament. C. Ligamentum flavum. D. Supraspinous ligament. Answer, B. Alar ligament. Which cervical vertebra is characterized by a long, non-bifid spinous process that is easily palpable? A. C1. B. C4. C. C7. D. C2. Answer, C. C7. The atlas, C1, lacks which of the following typical vertebral features? A. Transverse processes. B. Vertebral body and spinous process. C. Laminae and pedicles. D. Transverse foramina. Answer, B. Vertebral body and spinous process. Which movement primarily occurs at the atlanto-occipital joint? A. Rotation. B. Flexion and extension. C. Lateral flexion. D. Axial rotation. Answer, B. Flexion and extension. Which cervical vertebra is most involved in the no movement of the head? A. C1. B. C2. C. C4. D. C7. Answer, B. C2. The uncinate processes are a feature of which vertebrae? A. Thoracic vertebrae. B. Lumbar vertebrae. C. Cervical vertebrae. D. Sacral vertebrae. Answer, C. Cervical vertebrae. Which cervical vertebra is the smallest and supports the skull? A. C7. B. C1. C. C2. D. C3. Answer, B. C1. Which structure is located in the anterior arch of the atlas? A. Spinous process. B. Groove for vertebral artery. C. Facet for the dens. D. Lamina. Answer, C. Facet for the dens. Cervical vertebrae can be distinguished from thoracic vertebrae by A. Presence of costal facets. B. Absence of transverse foramina. C. Bifid spinous processes. D. Larger vertebral bodies. Answer, C. Bifid spinous processes. The superior articular facets of cervical vertebrae face A. Posteriorly and medially. B. Posteriorly and superiorly. C. Laterally and superiorly. D. Anteriorly and medially. Answer, B. Posteriorly and superiorly. What is the primary role of the transverse ligament of the atlas? A. Limit rotation of the head. B. Stabilize the dens against the anterior arch of the atlas. C. Support the vertebral arteries. D. Connect the atlas to the occipital bone. Answer, B. Stabilize the dens against the anterior arch of the atlas. Which cervical vertebra has the largest vertebral foramen? A. C1. B. C2. C. C7. D. C5. Answer, A. C1.